Hi, this is Dr. David Tener. We're here at the Goldberg Tener Clinic, where we specialize in the reversal of chronic disease. And today I'm joined by Jonas Rodriguez and his father. And Jonas has done beautifully under our care. He was diagnosed last year with Juvenile Rheumatoid Arthritis, and he is going to share his story with us today. So, Jonas, tell us a little bit about the issues you were having last year, what happened. You had seen a rheumatologist, I understand. So, fill our audience in with what your story was.
Well, it began when I noticed that my leg was hurting a lot for several months, and every time I went upstairs or like when I had to get out of the bus, I had to stiffen my legs so it wouldn't hurt as much. We thought it was something wrong with the bus because when I sat down, I was so tall that my knee would hit the back of the seat in front of me. But it wasn't that, so we got it checked out by a doctor, and it turns out I had rheumatoid arthritis.
Okay, and you saw a rheumatologist?
Yes.
Okay, and at that time, Jonas had some lab work done. Two inflammatory markers, important inflammatory markers, the C-reactive protein and the sedimentation rate were both very high, right? Yeah, his C-reactive protein was 10.5. Normal, according to that lab, was less than 1, so it was more than 10 times the upper limit of normal. And his sedimentation rate was 83. Normal level for us is less than 10, particularly for a guy of his age. You're 15 years old, right?
Yes.
So when the inflammatory markers are real high like that, that is consistent with the rheumatological issue and the pain that you were having.
Mm-hmm.
So when you were at the rheumatologist's office, what do they want to do? What do they recommend for you, Jonas?
They tried putting me on drugs.
What drugs? Do you remember what drugs they wanted to put you on?
No.
Well, I know because we wrote it down when you told us last year when you first came in. They wanted to put him on methotrexate, and they also wanted to put him on steroids, two very common drugs that are given for these types of issues. They don't actually get the patient well. They suppress the immune system and suppress inflammation, but they come with the potential for a lot of side effects. So Jonas and his father declined. I think you may have taken one dose of methotrexate, one dose, and you decided that you didn't want to go that route anymore. So Jonas came in to see us with his parents, and we did a workup on him and did some specific laboratory studies and developed a program for you to follow in an attempt to get him healthy as opposed to treating his symptoms. And that's really what we focus on. What's causing the problem? Let's develop a program to address those factors and then build health, and then we watch people get well. And so Jonas came in last year, originally in December of 2019. It's now May. It's about 5 months later. What's the difference now, Jonas? How are you feeling?
My legs don't hurt at all. I can bend them perfectly.
Mm-hmm.
And the swelling has gone down from the inflammation.
Mm-hmm. And the new lab work, you had done, the sedimentation rate was at 83. It's now at 5, which is perfectly normal. And his C-reactive protein, which was 10.5, is now less than 0.5. So the inflammatory markers have normalized entirely, which is consistent with the improvements you're reporting in your joints, the mobility in them, the lack of pain now, which is fantastic. We're thrilled. One other thing you had when you came in originally was some pretty severe seasonal allergies, right?
Yes.
And how has that changed for you over the last 5 months?
Right about now, I'll probably be blowing my nose inside of a tissue because my nose would be always so stuffed and I could barely breathe.
Mm-hmm.
My eyes would always burn from itching when I went outside because of all the pollen. I would try to stay away from it back then, but now I'm all fine.
And now we're in Georgia in the middle of pollen season. It's May, and the pollen's really high out there. Are you having any symptoms?
No, I'm perfectly fine right now.
Mm-hmm. So this immune system has quieted down. This autoimmune rheumatological problem is now resolved, and as a result of that, also his allergies have now improved, and those things oftentimes go hand in hand. So we're thrilled with the progress. Mr. Rodriguez, give us your review of his status and the progress he's made. What have you noticed?
Oh, wow, I say thank you God first, then, and the second, then to know about you, the Goldberg Clinic. Then I can talking everybody about you guys.
Oh, we appreciate that.
When I see the progress from my son.
Wonderful.
Yeah.
Well, we're thrilled. So, Jonas, thank you for sharing your story. I think it will serve as an inspiration to other people who are suffering with this issue, and also to know that there are ways of recovering and getting healthy and not having to be dependent on drugs the rest of your life. So thank you very much.
Thank you, doctor.